give us, give us the setup as to, what you were doing before the pandemic.
Yeah, James, thank you. For me, my primary purpose, as for most doctors, is to improve patient outcomes. So, I've been campaigning on this area, this issue on population health, and why are we not optimizing it? And in many ways, in many parts of the world, in fact, we are regressing in terms of our mental and physical health. So for me, my research, my area of interest, my advocacy work has been looking at the root causes of that, going back to, say, probably 2010, where I really hit the mainstream hard, initially around highlighting the fact that we have an obesity epidemic in the UK and many parts of the world, why our hospitals become branding opportunities for the junk food industry. So that's really where I started my work. And of course, that built up to when we connected. And of course, also during the pandemic, I was someone like other people, very disappointed that our public health authorities hadn't highlighted the fact that there was a clear link between poor outcomes from COVID and excess body fat, conditions linked to being overweight or obese. In fact, that ultimately proved to be, correct, in the sense that much later on, we discovered that 90% of the deaths from COVID happened in countries where more than half the population were overweight or obese. So throughout 2020, I was a big public advocate on that. I managed to break the mainstream, BBC News, Good Morning Britain, did a lot of international podcasts as well, wrote articles in medical journals and newspapers really to highlight this. And then Matt Hancock, the Secretary for Health, in the summer of 2020, actually asked me to advise him on the links between COVID and obesity and what should be done. And I basically said to him that we've got essentially a ultra-processed food industry, big food, who are behaving like tobacco companies did many years ago in the way that they engineer their products to become addictive. And they've managed to get them everywhere. And then they fuel the consumption of these foods through advertising, even to children. So therefore, the solutions have to be not just about educating the public, but policy changes that allow, the healthy choice to become the default choice. Now, that's one thing, he supported me and said, yes, thank you, Aseem. And Boris Johnson on the back of that then said he was launching a war on fat. And alluded to some of the things I'd recommended, but ultimately they haven't implemented any of those things, like taxing ultra-processed foods, banning advertising of ultra-processed foods, reducing the availability of them. For example, why are hospitals still 75% of the foods purchased in hospitals are still ultra-processed? So once one understands that, James, which is what I have done and others have done in this space, you then have to campaign to make sure the education gets out there, but also for people to understand why these system failures still persisting. And ultimately, it's because there is a collusion of sorts between people that we thought to trust, like medical establishment bodies and government, and these big, powerful industries whose only interest is to make money. And they often lie in their pursuit of profit, and they harm people and they kill people. Let's just not beat around the bush here. In 2018, I gave a talk in the European Parliament called Big Food and Big Pharma Killing for Profit. And now, as we move forward through the pandemic and, hopefully on the other side of it, and looking back at what's happened, for example, at the excess and manipulations of pharma in relation to the vaccine we'll get onto, we're dealing with something that we've never dealt with before, on a scale we've never dealt with before, that is truly horrific in terms of the harm it's done to population health and the harm it's done to trust as well in the medical establishment and government.
Yeah, absolutely. I want to give you a shout out, actually, because when we were sitting there at CrossFit, one of the things that you were talking about with regard to, I think, statin therapy at that time was the difference between relative risk and absolute risk. And, when the pandemic came along and they started talking about the success of the vaccine, straight away, I was just like, hang on a minute, I've heard this before. I know how this thing goes, 95% effective, reduction 95%. I guess I just want to credit you for giving me that context, because ultimately I felt like it allowed me to sort of see things a lot more clearly, and also see how the sort of pharma marketing machine was working even in 2020 before the vaccines arrived.
No, absolutely, mate. It's a really good point. So I think there is a big issue as well around basic health and statistical literacy. And that's partly because people aren't trained or conditioned to think in those ways, but it's exacerbated by the fact that the industries exploit statistics and numbers to exaggerate maybe fears or even benefits of intervention. So, without understanding the numbers involved in basic terms, and I'll give you some examples in a second, Doctors, the public, patients are vulnerable to exploitation of their hopes and anxieties by political and commercial interests. And that's what we've seen happen during the pandemic. So, for example, one of the issues around combating the pandemic and misinformation on the COVID pandemic is the fact that, many people had a grossly exaggerated fear of COVID. Now, that doesn't mean that I'm not saying that COVID wasn't devastating or didn't cause harm to people who are particularly vulnerable. I know people that have died from COVID. I'm managing some patients with long COVID. It was a problem, but we need to put it in context so that we could manage it better through more rational ways of thinking rather than a fear-based approach. So, for example, during the pandemic, it was one survey suggested that 50% of American adults thought their risk of being hospitalized from COVID was 50%, as in 1 in 2. Nothing could be further from the truth when the actual figure was maybe close to 1 in 1,000 for most of those people. So this is a big issue, a big problem. And of course, for me, what I try and do is when I have conversations with patients, I always think about how can I communicate what I'm interpreting in terms of, health issues, policy issues, but even in terms of my clinical practice, how do I interpret that information in a way that the patient can understand? So whenever I approach these areas and these issues, that's where I go to. And when the data is available, then one can break down the information. So for example, statins, we talked about statins, one of the most lucrative, most prescribed drugs in the history of medicine, trillion-dollar industry. Most people taking statins don't know when they're prescribed the drug that it won't prolong their life based upon the highest quality level evidence we have. And they'll give them maybe a 1%. These are people that are sort of not high risk of heart attacks. People have not had heart attacks, for example. It gives you about 1% benefit in terms of over a 5-year period in preventing a non-fatal heart attack or stroke. But that doesn't mean people shouldn't take statins. It's like, well, actually, what ethical evidence-based medical practice teaches us and tells us and guides us on is that we have to have these conversations with patients. If we're not doing that, we're not really adhering to ethical evidence-based medical practice. So I'm somebody that is a big proponent. If somebody asks me, what are you? What are you about? What are you talking about? What are you advocating for? I would say, I'm an advocate for ethical evidence-based medical practice. That's what drives me. That's what everything that I do in medicine comes back to that.
Yeah, appreciate that. Well, look, let's jump into it because, ultimately, you've sort of, I guess, veered a little bit. You're talking out about some of the most, caustic issues in society now, and I'm super grateful. And one of the reasons I wanted to have you on here, we've had quite a few conversations recently about heart health. We've been talking about it this quarter, and you're from a family of well-known doctors, and I think it was the situation with your father that sort of alerted you to to something going on that now is like on the forefront. So you want to just tell the story of what happened in 2021?
Yeah. So first and foremost, James, what I would say is despite being someone that's, perhaps one of the leading sort of voices, if you like, or loudest voices, let's say loudest voices in the last decade, calling out the excesses and manipulations of pharma. I never conceived of the possibility, because it's not about throwing the baby out with the bathwater. A lot of the stuff we do in medicine is very good. The problem we've got in society is we're doing too much, and there are excesses that are causing harm, and the net effect is problematic. So it's not that all medicine is bad, but in general, as we've talked about this before, James, you can't live a healthy and happy life on lots of pills. Ideally, you want to avoid that situation. And what happened in 2021 is but considering that, I never conceived of the possibility that a vaccine could do any specific harm. Vaccines are the holy grail in medicine. They are, if there was when you think of the definition of safe and effective, one of the first things that should come into your mind is vaccines, because traditional vaccines have certainly been thought to be that way. Although I know there are groups of people out there, and I'm open to thinking about this further with time, but I know there are people out there that are even concerned about maybe we're over-vaccinating as well with many different vaccines together. That's a separate issue. But certainly coming to 2021 January, I didn't conceive of vaccines causing a problem. And just to give people some context in the numbers here, traditional vaccines will probably give you a serious adverse event rate of maybe 1 to 2 per million people vaccinated. Very, very small numbers, 1 in a million chance, right, of having a serious adverse event. It's not zero, okay, but it's low, it's very low. So that was the backdrop.